Welcome back to Healthy Habits channel. Today, we're going to look at 31 facts about breast cancer you'll be amazed to know. Did you know that breast cancer is the most common type of cancer for women? Did you know most women are unable to recognize the early signs of breast cancer? Did you know early detection of breast cancer has saved the life of many women across the world? Since breast cancer is so common, it makes sense to learn more about it. Remember, the month of October is the Breast Cancer Awareness Month. It is therefore important to be proactive about your health. Simply put, breast cancer is the uncontrolled growth of breast cells. Most women suffer from this disease without even knowing what it's all about. Breast cancer is actually more complex than you could ever imagine. In this video, we'll be showing you 31 facts about breast cancer that will definitely amaze you. If you are new here, you can consider subscribing to this channel so that you will receive a notification whenever we put a new video online. 1. Breast cancer occurs almost entirely in women. 99% of breast cancer cases occur in women. This means that while breast cancer in men is very rare, it does occur. 2. Second leading cause of cancer-related death. Breast cancer is the second leading cause of cancer death among women. Lung cancer is number 1. 3. Men can also develop breast cancer. A man's lifetime risk of breast cancer is about 1 in 1,000. Many people do not realize that men have breast tissue and that they can develop breast cancer. But breast cancer is less common in men because their breast duct cells are less developed than those of women and because they normally have lower levels of female hormones that affect the growth of breast cells. 4. According to the National Cancer Institute, 1 woman out of 8 stands the chance of being diagnosed of breast cancer during their lifetime. 5. The leading risk factor for breast cancer is simply being a woman. Though breast cancer does occur in men, the disease is 100 times more common in women. 6. Obesity is a known risk factor for breast cancer. That's because estrogen is carried in fat cells. The more fat cells that are present, the more estrogen is in the body. Women with high lifetime exposure to estrogen may have increased breast cancer risk. 7. The first operation to use anesthesia was a breast cancer surgery. 8. The incidence of breast cancer is highest in more developed countries and lowest in less developed countries. 9. Breast cancer was often called the nun's disease because of the high incidence of nuns affected by the cancer. 10. Women with cancer in one breast have a 3 to 4-fold increased risk of developing a new cancer in the other breast or in another part of the same breast. 11. Another top risk factor for breast cancer, simply getting older. As you age, your risk of breast cancer goes up. Most breast cancers are found in women age 55 and older. 12. Breast cancer is more common in the left breast than the right. The left breast is 5 to 10% more likely to develop cancer than the right breast. The left side of the body is also roughly 5% more prone to melanoma, a type of skin cancer. Nobody is exactly sure why this is. 13. You can decrease your risk. Breast cancer cannot be prevented, but there are things such as diet, exercise, and other healthy lifestyle choices that can help decrease your risk for developing breast cancer. 14. Every minute, somewhere in the world, a woman dies from breast cancer. That's more than 1,400 women every day. 15. Quit smoking to control risk of many diseases, including breast cancer. Younger women who smoke have a higher risk of breast cancer than their non-smoking peers. 16. Most women, about 8 out of 10, who get breast cancer do not have a family history of the disease. 17. There are a number of misconceptions about what can cause breast cancer. These include, but are not limited to, using deodorants or antiperspirants, wearing underwire bras, having a miscarriage or induced abortion, or bumping, bruising the breast tissue. 18. Women who have close blood relatives with breast cancer have a higher risk. Having a first-degree relative, mother, sister or daughter, with breast cancer almost doubles a woman's risk. 19. Caucasian women are slightly more likely to develop breast cancer than are African American women, but African American women are more likely to die of breast cancer. 20. Symptoms of breast cancer can include anything from a change in the look or feel of the breast to spontaneous nipple discharge, or a lump. Know the signs and symptoms of breast cancer. We made a video on that, check the link in the description box. 21. Breastfeeding has consistently been shown to reduce breast cancer. The greater the duration, the greater the benefit. 22. October is National Breast Cancer Awareness Month. The first edition took place in October 1985. 23. Over 2.8 million breast cancer survivors are alive in the United States today. 24. Women often detect breast cancers themselves, so don't underestimate the importance of a monthly breast self-exam. Make sure you do your breast self-exam regularly. 25. Minimize alcohol intake to control risk. That means 1 glass of wine, 1 beer or 1 hard liquor drink per day. Drinking 7 drinks in one day and none the rest of the week is not okay. 26. Mammography was initially used in 1969 when the first specialized X-ray units for breast imaging were developed. 27. Mammograms save lives. Mammograms are proven to reduce the rate of death from breast cancer. The Breast Center recommends annual screening mammograms for women starting at age 40. 28. Most women now survive breast cancer. Huge progress has been made in recent years in breast cancer. In fact, breast cancer management across risk assessment, prevention, surgery, radiation, and other treatment, has changed dramatically. Death rates from breast cancer in more developed countries have been declining in recent years, and now survival rates are 80% or over in countries like the US, Sweden and Japan. However, survival rates remain below 40% in low-income countries. 29. The pink ribbon is an international symbol of breast cancer awareness. The first known use of a pink ribbon in connection with breast cancer awareness was in the fall of 1991. 30. Tamoxifen has been greatly used for breast cancer treatment. Tamoxifen is a type of hormone, endocrine, therapy used to treat breast cancer in both premenopausal women, women who have not yet gone through the menopause, and postmenopausal women. It can also be taken by men who have breast cancer. 31. Surgically, breast cancer can be treated either by a total mastectomy, total removal of the breast, a quadrantectomy, removal of a breast quadrant, a nodulectomy, removal of a breast nodule, or a lumpectomy, removal of a breast lump. Thank you for watching this video till this point. We would like to congratulate you because very few of our viewers make it to this level. Hope you've learned much about breast cancer today. If you have any other interesting fact about breast cancer, kindly drop it in the comments section. We would be pleased to hear and learn from you.